Joining us now to discuss how we got to where we were able to lift the mask mandate, Dr. David DeJean. He is Associate Professor at Kirk Kerkorian School of Medicine over at UNLV. Doctor, thank you so much for joining us today. We appreciate it.
My pleasure.
Big decline in Omicron, as so many physicians talked about happening, with it being more of a mild and highly transmissible. Did you expect it this fast?
Well, this was quite a dramatic peak, and sometimes when you see that, you'll also see a dramatic fall. And so that's somewhat fortuitous. We peaked a couple weeks ago, and we clearly are on the way down now.
Now that the masks are off, what kind of advice can we give to our viewership, and just a reminder about how transmission happens in terms of COVID-19 now that so many will not be wearing a mask?
Well, I think it's important to remember that, the mask can still protect the individual. And so if there are people that have underlying conditions where they may be at higher risk for developing severe disease, then I would recommend continuing to wear the mask, and certainly in the settings that we talked about, in healthcare settings, in public transportation and other places, you may want to still continue to wear the mask.
Doctor, recent study about the benefits of vitamin D, which we've heard about with COVID. What are some other things we can tell our viewers to try to raise their immunity level as they may be exposed to more germs?
Well, I mean, just the usual things we talk about: eating well, getting lots of sleep, trying to avoid illnesses to the extent that you can. And with this particular disease, just some of the things we put in place months ago, even actually now a couple of years ago, like social distancing, hand washing, and wearing of masks are still important.
Last question for this interview. As we move from pandemic to endemic, what is your advice in terms of if a new variant does pop up? How should we handle it as we move forward and mutation happens?
We've been here before. We've seen this movie before, so we still need to, I think, be cautious.
Okay.
We're on the way down, but the numbers of cases are still quite high. The test positivity rate is still, hovering around 20% statewide, and that's a very high number. If you remember when we tried to talk about opening schools months ago, we were hoping to have positivity rates of less than 5%. So we're way above that now, so we want to still be careful.
Doctor, we appreciate your expertise and time. Doctor will be back with us in the 6 p.m. hour on 8 News Now. Thank you, Doctor.
My pleasure.